Hi everybody, I'm Dr. Maria Lombardo with Lombardo Cosmetic Surgery, and I just want to answer a real quick question that I get asked all the time about breast implants. When do you have to change them? And the quick answer is the manufacturer says every 10 years, but honestly, my philosophy there is if it ain't broke, don't fix it. So just because the calendar ticks over to 10 years doesn't mean you have to do surgery. If they're fine, if you're still happy with the size that you are, if they haven't fallen or there's no breastosis, there's no reason to change them if they're intact and you still like them. So I don't know how short of an answer that actually was, but 10 years is kind of the rough estimate. Part of the consideration there is if you're in your 20s when you get your implants put in, where are you going to be 10 years from now? Are you going to have kids? Are you going to be married? Are you going to be divorced? Do you want bigger breasts? Do you want smaller breasts? No one knows the answer to that. We can't predict the future. So good rule of thumb, every 10 years. But again, if it ain't broke, don't fix it.